First, we're going to be palpating the first metatarsocuneiform joint. We're going to start by finding the first metatarsal, working down to find the first metatarsal head, and then working in right behind that. So here's the first metatarsal bone. Find the head, it's the thing that sticks out the most. And it's right back in behind there. You can feel the divot right between the navicular tubercle and the first metatarsal head. Next, we're going to find the navicular tubercle. It's right behind the first metatarsal head. And so first we're going to find the first metatarsal, work down. There's the first metatarsal head. There's the first metacarpal or metatarsal cuneiformal joint. And then right proximal to that is the navicular tubercle. Next, we're going to find the head of the talus. You're going to start by finding the first metatarsal again, working down to the navicular tubercle, and then you're going to have the patient evert the foot in order to have the head of the tarsal or talus stick out. So work down, first metatarsal, head of first metatarsal, navicular tubercle, have my patient evert their foot, and it's the thing that sticks out right there. So go ahead and come back, and then evert again, sticks out right there. Next, we're going to find the medial malleolus and the sustanaculum tali, which is distal to the medial malleoli. But to find the medial malleoli, assess the ankle here. You have your calcaneus, you have your gastroc muscle that comes down here, which attaches, and then there's this kind of fossa area. The big prominence right here is the medial malleoli. And so then to find the sustanaculum tali, you're going to put one finger on the distal malleoli and palpate right down below there. You should kind of feel some tendons, ligaments move. It's an attachment point. Next, we're going to find the medial tubercle of the talus. You're going to start by finding the medial malleoli. You're going to go distal, and then you're going to go posterior. And it's barely palpable, but it is quite sensitive and tender, so it's right there.
So today we're going to palpate the lateral side of the foot. So starting with the fifth metatarsal on the lateral side, working more proximal, you get to this bony prominence on the side, and that is the styloid process of the fifth metatarsal. And moving more laterally on that is the insertion site of the peroneus brevis. Next, we're going to find the calcaneus in the lateral malleolus. So starting with the styloid process of the fifth metatarsal, work your way proximally, and this is your calcaneus or your heel bone, and superior to that is a bigger bony prominence, which is the lateral malleolus. And on the calcaneus, distal to the lateral malleolus is the peroneal tubercle, and this is where the peroneus brevis and longus tendons separate. Today we're going to palpate the sinus tarsi. So you grasp your patient's heel and take your free hand and place your thumb in this depression anterior to the lateral malleolus, and in here it contains the extensor digitorum brevis. Now we're going to palpate the dome of the talus. So you, staying on the lateral side, just anterior to the lateral malleolus, have your patient invert and plantar flex the foot, and a small portion of the dome can become palpable on this lateral side. Next, we're going to palpate the inferior tibiofibular joint. So after you have found the dome of the talus, move more proximally, and you can't palpate the joint itself, but you can palpate a slight depression right over it. Next, we're going to palpate the medial tubercle of the calcaneus. It lies on the medial plantar surface of the calcaneus. It is broad and rather large and provides for an attachment site for the adductor hallucis muscle medially and the flexor digitorum brevis and plantar aponeurosis anteriorly. Next, we're going to palpate the dome of the calcaneus. The posterior third of the dome protrudes from behind the ankle joint. If you begin at the malleoli and move plantarward and posteriorly, the protruding bone is the calcaneus. The superior portion of the bone that protrudes is the dome of the calcaneus.
Next, we're going to palpate the sesamoid bones. For the sesamoid bones, you're going to find the base of the first metatarsal bone, and you're going to then go up to the first metatarsal phalangeal joint, and then right there is where the first sesamoid bone should be, underneath the great toe. And then you're going to just keep going along the pad of the foot here, and you can find the rest of them. Now we're going to palpate the metatarsal bones. So now you have the first metatarsal that's off of the big toe. So follow down from the toe all the way back to the cuneiform bone. Then you have the second metatarsal all the way back to the cuneiform, third metatarsal, fourth metatarsal, and the fifth, which goes on the lateral outside part of the foot. All of those go to the cuneiform bones, and then up here are the metatarsal phalangeal joints at each. So now we're going to palpate the phalanges, starting with the first, or the great toe. This is the great toe right here. It has one interphalangeal joint here in the middle. Then the second phalange with a DIP, distal interphalangeal joint, and then the PIP, proximal interphalangeal joint. And then the third phalange, the fourth phalange, and the fifth. Each of these also have DIP and PIP.